Wasunthara remembers the moment he found out his son was infected with a respiratory illness. In the middle of the night, his son was cold and had problems breathing. He was in shock and felt helpless.
I feel sorry for the kids because the kid didn't know what to do. They cannot breathe. The only thing they can do is crying.
He quickly took his son to the hospital to be treated, and thankfully he recovered. Since the start of 2023, there has been a significant number of cases of respiratory illnesses among children in Thailand. Parents are worried, given the news of respiratory illnesses occurring in various parts of the world, including China, the United States, Australia, and Vietnam. However, doctors assure families there is nothing to worry about, as the outbreak is just an aftershock of the COVID-19 pandemic.
There are a total of 5 types of viruses and 1 bacteria that are infecting the children here in Thailand. The good news is doctors say they're not life-threatening. It's just a result of children not getting enough exposure to germs during the pandemic.
According to doctors, the immune system of a human body is dynamic. Continuously being exposed to bacteria allows it to fight against all sorts of germs to prevent infections. For 2 to 3 years, there was an, quote, immunity gap or immunity debt, where children may have not been exposed to enough bacteria, did not receive vaccines, and had low immunity. This is why the group most vulnerable now are children under the age of 12, especially those born in the past 3 years. However, the viruses going around have existed way before the pandemic.
The respiratory diseases we're seeing today do not originate from one particular country, because each country is seeing this occurrence at the same time after the relaxation of lockdown measures. Therefore, the easing of restrictions needs to come in stages.
Doctors say there is no new virus spreading from one country to another. It is just each country dealing with their own mix of seasonal viruses. Having gone through a serious pandemic, parents have become even more cautious. Wasunthara says his family is definitely more prepared for any infection.
We prepare, but we cannot stop or prevent 100%. We just have to go with the flow.
The Thai government is confident hospitals are properly equipped to handle the increased number of patients. It should take about 2 to 3 years before infections are back to normal levels. For now, parents like Wasunthara are recommended to encourage children to wash their hands and get them vaccinated. Doctors say it is not a time to panic, but a time for caution.